we found toxicity profiles that were in keeping with what is seen for these two agents separately. We did not find additive toxicity. The dose-determining toxicities for Dalantercept are fluid retention and anemia. Those are dose-dependent, and particularly edema-related event drove the final decision of how to proceed in part 2, at which dose level. A formal MTD was not reached on this trial. This was a very well-tolerated combination, even at the highest dose levels. The peripheral edema events that we saw with Dalantercept Axitinib were very well managed with diuretic therapy, and were not very frequent at the dose level that was ultimately chosen to move forward into part 2. On this trial, for the patients that are evaluable, we saw a median progression-free survival of about 8 months across the entire study population. That's including the low dose levels. For the dose level that is chosen to proceed in part 2 of the study, the median progression-free survival has not been reached because we haven't seen sufficient events for that, which obviously is very encouraging. If you compare that to the phase 3 data that is out there for Axitinib alone in TKI pre-treated patients, then that is promising, because for TKI pre-treated patients, Axitinib on the phase 3 trial achieved a median progression-free survival of less than 5 months. So at least the signal here is suggesting that this might be able to improve upon anti-cancer response. We're very excited about part 2 of the study and are hopeful that we can see more data to build upon these very encouraging early results.